Welcome to It's a Grand Life. Did you know that in the United States alone, 2.4 million kids are being raised by their grandparents or other family members other than mom or dad? 2.4 million. It's a Grand Life is a podcast for those grandparents and kinship caregivers who are committed to making a difference for those kids. Grand families are in every neighborhood, every city, tribe, and territory nationwide. If this is you or someone you love, this podcast is for you. Our goal is to offer hope and resources to help you. Please subscribe to our YouTube channel or follow us wherever you get your audio podcasts and leave a review. Every new subscriber and review helps us reach others that need assistance. Welcome to another episode of It's a Grand Life. Hello and Happy New Year. We'd like to welcome you to a new year of It's a Grand Life, and you are going to be blessed today. We have got a seasoned professional with us who specializes in supporting grand families. Our guest today is Lisa Grodsky. She's the Program Operations Manager from Oakland Livingston Human Service Agency. And she's right here about maybe 10, 15 minutes from our studios. And Lisa, we're just so delighted to have you here and on It's a Grand Life. And just welcome and Happy New Year.
Thank you so much, Craig, and Happy New Year to you and all the viewers.
So you've got to tell our audience, how did you get involved in OLHSA? And it's not OSHA, if you're listening at home. This is not, no, they're not going to come look at the chemicals that you're using at the office, but the Oakland Livingston Human Services Agency. But you've been there a long time. And how did this journey begin for you?
Well, the journey began for me when my oldest child, who's now 26 years old, was in preschool. I was seeking preschool, and we had experienced some situations where I was expecting a second child. My husband had recently lost a job, and paying for preschool was just out of the question, out of our budget. And right. Somehow or another, friends of mine really believed that I should enroll my child in preschool, and I found the Head Start program, and I volunteered as much as I can, with a newborn to kind of pay it forward and pay back for what they were doing for our family during that time of need, and so I started volunteering for OLHSA, and I was active with their Head Start Policy Council, and one day just kind of uttered, I think I need to get a job soon, because I found myself volunteering an awful lot. And they said, well, OLHSA is hiring. And so I applied for 3 jobs and was asked if I would be interested in one of them. And that was back in January of 2005. So wow. January of 2024 is my 19th anniversary with the organization. And I ran some energy education classes and worked in our energy services for about 8.5 or 9 years. And the rest of my time at OLHSA has been working with older adults and kinship caregivers, grandparents who are raising grandchildren. I was very aware of it used to be called Grandparents Acting as Parents, and that was the old name, and they nicknamed it the GAP program. And for obvious reasons, there's a gap between grandparents and their grandchildren. And I would refer my clients in my old program to the grandparents acting as parents, and people in my personal life, to this support group. And never in my wildest dreams, Craig, did I ever imagine that I would be asked to run it. But one day I was, and I was willing to take on the challenge. And, I had some big shoes to fill. But I'll tell you, I am so passionate about advocating and working with this group, as you know, and I've met some outstanding people and learned a lot about their challenges and needs over the years.
Well, tell our audience about the 110 grand families that you support. or that you have supported in the past 19 years, going on 19 years. What is that like? What exactly do you do for those families? And what are some of the cool outcomes you've seen over the past 2 decades?
Yeah, sure. So, our funder has a minimum requirement of how many people we should be servicing per year. And when I first started working with this population back in 2013, like directly, I only needed 40 kinship caregiving relatives. Today, actually, they've increased it to 115.
Wow.
There's a little asterisk there. 115 that are 55 and over are for this primary funder.
Okay.
We service almost 200 people a year
Wow.
who call us, who have a crisis regarding kinship caregiving, who need help navigating their journey. They have a lot of questions that, they don't have anybody else to answer. It's being a kinship caregiver isn't one of those things like, being told by your dentist you need a root canal. A lot of people have had a root canal, and you can find out what to expect by just asking people But raising grandchildren, it's not usually the kind of things that you stand up on your soapbox and
Right.
say, hey, everybody, who else is raising grandchildren? I'm going to be doing that soon, and I need to get some help here. This is a generally isolated population who oftentimes are shunned from their family and their grandkids' school communities just because they don't understand why they're
Right.
doing it or the dynamics of this family situation now. There's always a lot of questions. What happened to the parents, or things that are
Oh,
private. And
exactly. And well, Lisa, you use a term kinship caregiver, and I know we've got folks in our audience that they know kin, maybe from watching Beverly Hillbillies or something like that. But what does kinship caregiver mean?
That's a great question. And this is a word that we should use more often because there are more people who are providing kinship care, I believe, than people that are providing foster care in the state of
Right.
Michigan and beyond. Kinship care are relatives who are the primary caregiver of another relative. And in our context, Craig, it is used for parenting a relative's children.
Right.
And so these would be minor children under age 18 who are, for whatever reason, their parents are not able to caregive for their own children.
Right.
And whether it is an informal situation where a relative maybe rescues a child from a situation of maybe neglect or something else, or maybe it's something a little bit more formal where the courts are involved or foster care, the child welfare system is involved, where maybe a child is placed with the next of kin,
Right.
and anyone who's related to a child that they love who could be considered the next of kin should really be familiar with the words kinship care, because one day, we hope not, but one day you may be faced with, would you look after these relatives' children? And if you are, you need to know that the term is kinship care, so you know how to find resources in support groups like OLHSA's Grandparents Raising Grandchildren or other supports that are found around the state.
So I know in a recent study that you folks had also worked on, looking at grandparents raising grandkids, it was hard to nail down the right term. I know that was a challenge. Are we going to call them grand families? Are we going to call them kinship caregivers? But it can be grandparents, and more often than not, it's relatives taking care of relatives. I like how you said that, and it's something that all of us that are providing care to our relatives, when we're given this option, of course we do it because we love the kids that we are trying to support and raise, and the work that you folks do at OLHSA to support us is absolutely terrific. And one of the questions I wanted to ask you was, how important is it for grand families or kinship caregivers to network with other folks in the same role and the same position? And, because this could be pretty lonely if you think you're the only one out here doing this, right? But that's not the case.
It is not. There are some data going out around that say that there are between 54 and 55,000 grandparents and other relative caregivers of relatives' children's or kinship caregivers. We call them grandparents raising grandchildren, but some of our 115 that are over 55 are definitely great aunts and uncles. Great grandparents are even raising a lot of great grandchildren. And there, and that isolation piece is really big, because there are an awful lot. It is healthy to speak to others that have a shared experience as yourself. Now, everybody's journey is definitely unique to their family situation, but you'll see a lot of commonalities between different grandparents. You have the ones, and when I say grandparents, I'm not necessarily referring just to grandparents, but relative caregivers. But the relatives will talk about, that mental health had played a role in why they're raising grandchildren. Substance use disorder had a role, teen pregnancy, abandonment, or even incarceration. And these are not easy topics to talk to people, especially strangers, about. But in the most healthy of situations, there are, facilitators who will move a conversation along to talk about the different reasons why somebody would be caregiving.
Well, one of the things that I learned that you folks provide, or a couple of the things I just thought were terrific. One is you've spent a lot of time on coping strategies and child rearing ideas for grand families. And we're out of practice, right? Now we've got these 3, 4, 5, 10-year-olds in the house and what have you. And maybe it's been a couple, 2 or 3 decades since we raised our kids. But that's where OLHSA really steps in to try and provide the support that these families need. And I think it's just terrific. But how are those coping strategies and child rearing ideas, how are they received by your constituents?
They're very well received, because we survey annually what their interests are, what kinds of things do they want to know. And you're absolutely right. Parenting even 10 or 15 years ago has changed immensely, especially post-pandemic. The pandemic really was a game changer when, even before COVID-19, we saw that a lot of grandparents didn't have technology in their home, didn't have internet, Wi-Fi available. And this is something that they would talk about at support groups is, the school issued maybe a tablet, and they had no idea what the child was even doing on it, or how to operate it. If the child had difficulty with it, they were feeling lost. The other thing was there was a lot of grandparents and kinship caregivers concerned that they weren't able to write notes to the teacher anymore, that they had to sign up on a portal that the school had provided and create a username and password. And many of these caregivers didn't even have email. And I encouraged them to get email years ago, just so they can have more time-sensitive information coming to them instead of waiting for something to arrive monthly in the U.S. mail. And so, over the years, we have created pilot projects like our Gigabytes for Grand Families, which helped train people how to use the technology and provide them with the actual devices and internet so that they could, do shopping online, grocery pickup at the door. They could do telehealth, and of course, access those school portals that was their main way of communicating with the child's teacher or school, regarding parenting matters that they are also responsible for.
the technology has come so far. There's an app on my phone that tracks Grace's bus travels. So when she's taking the bus on the way home, why is the bus late and what have you? So Grandma and Grandpa and Aunt and Uncle, we've got to get up to speed, don't we, on this new technology if we're going to track these grands. I know next time we're going to get together, and I hope our listeners will come back for our second show where we really talk about the advocacy that you do at OLHSA and how that really helps families behind the scenes. But I just had a couple other questions here. Where do you see the work of kinship caregivers and grand families in the future? I mean, is this a role that's expanding, you think, or is there more a need for more folks to get involved and to do the work that you guys are doing with your grandparent support and what have you? Or is this fading away, or is it expanding?
Well, I think that since Michigan has embraced finding relatives as the preferred placement of children, and I think a lot of other states are also going that way, when parents aren't able to take care of their own children, I see this need increasing. It is really truly a cause, Craig. A kinship care is a cause. It's a different kind of cause than foster care, but it's similar. It's a different type of cause than, say, breast cancer or anything like that, but it is a cause, and it is celebrated in September. And I've seen even growth over the last few years of the recognition of September being Kinship Care Month, because as a grandparent, you must know that the second Sunday of September is Grandparents' Day. It usually falls between Labor Day and Patriots' Day. And so Kinship Care Month is all month long to celebrate those relative caregivers of children, whether they're currently doing it, used to do it. They are to be celebrated. They do need, I really do see that, and I see it in the last few years, that programs are cropping up to help different types of kinship caregivers, maybe those that are kin caregivers because one or both parents are deceased, so that's one population segment of kinship care. Those that have one or both parents that suffer from substance use disorder, but there is overlapping, because sometimes a parent who had substance use disorder is now deceased. So you do see this overlapping in this community. And I see nonprofits also embracing kinship care. Foster care nonprofits who only used to focus on foster care are now including kinship care in their mission, which is huge and much needed.
So there's huge growth in this segment. And so if you're listening to our podcast today, and our listeners are in Utah and Colorado and all over the country, how would they connect with an appropriate agency like OLHSA where they live? How would you direct them to find folks like you guys in their state?
Well, there's a few ways. Some nationally recognized organizations such as Generations United or AARP are probably the two bigger ones who know a lot about kinship care. Your local communities, like community action agencies, like OLHSA is a community action agency. We're one of 27 in the state of Michigan, but there are over 1,400 in the United States. So finding your local community action agency, also your local area agency on aging or senior center. These are also places, but I'll tell you what, I'm seeing a lot of interest in school districts too. I would go to the school social worker or the school secretary and let them know that you are a kinship caregiver. Let them know that, they know you're raising a relative child, and ask them if they have any resources, because we're seeing more and more schools coming to OLHSA asking for guidance so they can start their own support groups within their own school community.
That is amazing. So this is Lisa Grodsky, as you've laid out here in this podcast. This is exploding across the country. It's becoming bigger than foster care support, and there's 1,400 agencies. Is that right, across the country that are providing the level of care that you guys are at OLHSA to try and support kinship caregivers and grand families, any way you want to talk that, describe that, to really make a difference for this population. And unfortunately, for a whole number of factors, the need for kinship caregivers to support these kids is just really exploding. And we absolutely salute the work that you guys are doing at OLHSA, and we can't wait to hear about your personal advocacy efforts in our next podcast. But Lisa Grodsky, thank you so much for being our guest here on It's a Grand Life. And if folks want to get in touch with you or your wonderful agency, what's the best number for them to reach out and get in touch with you guys?
Sure. The best number is, the area code is 248-209-2721. And you can always go to OLHSA's website, www.olhsa.org. And in the search area, just type in grandparents or grandparents raising grandchildren, and you'll find all the information there.
Absolutely terrific. Thank you so much for being our guest here on It's a Grand Life. And we look forward to having you back next time to find out about advocacy and how it's working here in the state of Michigan. But to all of our folks at home, again, Happy New Year, and we'll see you next time on It's a Grand Life. Thank you so much. Thank you for joining us today for It's a Grand Life. It's a Grand Life provides vital content, regulatory updates, and subject matter experts that are committed to supporting the 2.4 million kids and their caregivers from every neighborhood, every city, every tribe and territory nationwide. Please subscribe to our YouTube channel or wherever you get your podcasts and leave a review. Every new subscriber and review helps us reach others that need assistance. As caregivers, we are united in purpose. We are driven by hope while providing strength for today and hope for tomorrow. We are truly making a difference while living the grand life. If you have a suggestion for a future episode, please reach out to us. But we'll see you next time for another It's a Grand Life. Thank you for joining us.